Good afternoon. Welcome to another amazing show, Ditokello Tsa Hao. I am your amazing host, Tshepo Ngoato, and today we're going to be talking about TB. And today is World TB Day. We're actually doing a commemoration to ensure how do we eradicate TB. And today we're going to be joined by a professor and from the National Department of Health who would be going more into detail pertaining how is the Department of Health helping us to be able to ensure we eradicate TB. Because we know that in South Africa, we have got a vulnerable difference of communities and challenges that are going on. But how do we ensure that we support each other's communities and we ensure that we can fight the risk to be ensure that no one gets TB? But before that, we go to the amazing conversation with Prof. Please make sure that you follow us on all social media pages at Senec_Trust and simply go to our call to action number at 067-267-3103. And how are you, Profs?
I'm fine, thanks. And you?
I'm good, thanks. How was your day so far? Since today we are commemorating World TB Day, and you are the national leader within the Department of Health. Who are you? Where are you from? And tell us a bit about yourself.
So today the activities really include visiting homes of number of patients for screening to try and do TB screening. We're also hoping that there will be testing activities at the venue in the stadium, the Ugu district. And of course, we'll be hearing from leadership, getting a message of hope in terms of where we are in the fight against TB. What do we need to do? We'll basically be receiving our marching orders from our minister and other leaders, including Deputy President, who will be the main person for the day.
Since you mentioned that the Deputy President is here, what are the other key stakeholders who are here and what role do they play?
So this is an event that is hosted, it's organized by the South African National Health Council, SANAC. So all the SANAC groups are represented, your private sector, included. So SANAC is represented, government department. I know that officials from various state departments have been invited, the premiers, the MECs for health in the country, the TB managers and HIV managers from all our provinces are all expected to be part of this event.
Speaking about roles, because we know that we spoke about premiers and that, what role does government departments and health departments and other key NGO plays in fighting against stigma? Fighting against TB.
Okay. That's a very good question. The fight against tuberculosis in South Africa is led by the South African National Health Council. So it means that everyone is involved, all state department, the various constituencies within SANAC itself, state department, partner organizations such as Global Funds, such as PEPFAR, although now there are some issues with interruptions, but they've been also supporting us in this. UNAIDS and World Health Organization. So all these organizations are stakeholders that are supporting government, mainly Department of Health in the charge against in the fight against tuberculosis.
What is the current status as a country when it comes to TB? And are we really making progress as a country?
Yeah, that's a very important question. TB has been a problem since time immemorial. For more than 100 years, nothing happened until we started moving with better diagnostics. The introduction of GeneXpert in around 2010 was, in my view, a game changer because it helped to diagnose more, to find people with TB. Prior to GeneXpert, microscopies, the microscope that we're using could only pick half of the people with TB. Now you can imagine if you use such a tool for a very long time, you can't really make a lot of progress. But when we introduced molecular diagnostic like GeneXpert, we started to see progress. And this came like 5 years after introducing antiretroviral therapy that reduced mortality significantly among TB patients. So those two, the introduction of antiretroviral therapy and the introduction of GeneXpert are two critical interventions that helped us progress. So initially we saw decrease in terms of mortality prior to 2015. But from 2015 to present, the biggest improvement we have seen with the TB program has been the decline in terms of TB incidence. Number of new people every year has declined by 56%, which is it's a big plus. Furthermore, 56% of TB missing people have been reduced. So there's been a decline in those that are missing, 56% reduction in those that are missing, which meant that the treatment coverage is bigger. We had a huge gap, which is now reduced to 21%. So now we're supposed to treat 270,000 people with TB, per year. In 2015, it was above 500,000, around 500,000 a year. So you can see reducing the number, the incidence to 270,000 and reducing those that you are missing by 56% is now 21% of 270,000. So those two are critical, improvement. So what we really need to continue doing is find people with TB to close that gap. We need to find them all, treat them, so that we cut transmission within our communities.
And since you're speaking about close that gap, I know that within that there's a bit of challenges that are coming pertaining eliminating TB, right?
Yeah.
What are some of those challenges probably that we are facing as a country in ensuring that we actually eradicate TB?
Okay, I like your question because this is really critical. So in order to end TB, we need to do three things. Number one, bring down the incidence by 90% from 2015 to 2030 or 2025. We need to bring incidence down by 90%. I told you already gone down by 56, which means we are on track to achieve that. Number two, we need to bring down death rate, mortality by 90% as well for same period. We're not doing well in reducing mortality. So far, we reduced by 19% or so. So we still have a problem. A lot of people still die from TB in South Africa, partly because a big number of people don't stay on treatment. Adherence is a problem. Many patients start treatment, they don't finish. Number three, catastrophic cost. People must not undergo catastrophic cost because of TB, meaning that they should not spend more than 20% of their resources, annual income, because of TB. So treatment is free, but people have to pay for transport to go to facilities. They go to buy vitamins. They go to do all sorts of things. They spend a lot of money. That's what we call catastrophic cost. And 56% of people with TB in South Africa undergo catastrophic costs. So we had a problem with mortality and catastrophic costs. We're winning in terms of reduction on incidence.
How accessible is treatment in South Africa, and how are we ensuring that we actually make sure that people complete their treatment?
Yeah, treatment is free at all our clinics. The adherence counseling, I think, is lacking. Probably we need to learn that from HIV. I don't know I used to work as a HIV physician myself a long time ago. I felt that we did better in terms of HIV to educate patients. So we are strengthening patient education for TB, but also patient support. Like I said, although treatment is free, but people have to travel from their homes. They need to eat something before they take tablet. They can't take tablet on empty stomach. And that's where we've been talking to Department of Social Development to also improve in terms of support, psychosocial support and nutritional support to our people who get TB.
Okay. Then within, like, we know, and in each and everything that we do, there are policies here in South Africa that talks about HIV, AYP, etc. What policies and what strategies are in place in looking at high risk areas like your mines, your informal settlements, places like that, who are in the high risk areas of TB?
Okay, so in terms of the high risk areas, you congregate settings like correctional facilities and various places, similar spaces. We now have a multi-sector accountability framework through SANAC. And this is very helpful because then all state departments get to indicate what they're going to do. And we take SANAC on board. So it's still a beginning, but I think it will take us a long way because we'll then be able to get all these sectors on board and do one common thing. We just started. We're still at a phase where we agree on what should be done, really the essentials, but I think we'll go a long way. But the other thing that is happening in terms of, for example, TB in the mine, we work very closely with the mining sector. We had a project called TB in the mining sector. It's a project which closed. So we are in the process of integrating these activities. For example, when we have our meetings with between National Department of Health and Provincial Department of Health, in terms of those who are responsible for TB, we invite the mining sector colleagues, and we also attend their meetings. So we've started a process of integrating all the activities that they're doing, integrating their data and all that. I believe that process will help really integrate all this so that we also improve the management of tuberculosis in these areas. So correctional services, we've not engaged directly, but we send them messages to say we'd like to meet them. But we already took into Department of Social Development and the mining, we're talking and we're making progress. Yeah.
So this year's theme for World TB Day, it's called Yes We Can. Yes We Can End TB. In Commit, Invest and Deliver.
Yes.
How does it align with the South African TB response?
Yeah, this tagline aligns perfectly. It's really very well. It talks well with our thinking. You recall that this is the third year that we're saying, yes, you and I can end TB. But now we add commit, invest, and deliver. We need to strengthen our commitment. And this is really our thinking. We feel that it is time to strengthen that commitment. We are at the phase that we call, the CEO of SANAC said when the National Strategic Plan was launched that we're at a phase of do or die. You know, our strategic plan ends in 2028, and that is 2 years prior to 2030, when we need to say now we've ended TB or we're about to end TB. So we're in that do or die phase. So this is critical to strengthen our commitment, but we also want leadership to invest resources so that we are able to deliver. This is really perfect with our thinking in South Africa.
Okay. Since we know that treatment is a far key important thing that literally assist with TB, are there any new sets of technologies that are involved that National Department of Health is involved in, or new treatment that could be introduced to ensure that it can be able to assist the person that says, you know what, I don't want to take this treatment, maybe they're better or something like that?
Yeah, thanks a lot. So what we're doing in the Department of Health is to, number one, strengthen adherence to treatment. Actually, before that, the question of linkage to care is really critical. We're making effort to deliver SMSs to those that are found to have TB in South Africa. The process started 2-3 years ago, is improving, but is not yet where we want it to be. Number two, we want to retain people in care by introducing better, more tolerable regimens. In children, we're starting to introduce a 4-month regimen. We believe that the duration of the regimen is critical in getting acceptability and getting patients' cooperation to finish. For MDR TB, most of our patients, 90% plus, are now on a 6-month regimen, which is really very, very good. But we also know that we've introduced a powerful drug, bedaquiline, whereby a number of our people are getting resistance. So we introducing then technology called targeted next generation sequencing to help us diagnose bedaquiline resistance within a week of treatment when the patients start, because right now it takes up to 56 days to diagnose resistance. It can be very late if you intend to treat for 6 months. So the introduction of targeted next generation sequencing called TNGS is critical for diagnosis of resistance to bedaquiline, lanezin, these drugs that we use in the shorter regimen. But where we wish we could do something, but it's slow, is to the use of technology to enhance adherence. I told you that people don't finish treatment. A lot of people start, don't finish. We talk to them, we're improving adherence, counseling is okay, but we're making efforts to get something, a product that will be powerful enough to make sure people stay on treatment and finish. So that is still work in progress.
Since today is World TB Day, right? After that, what must happen to individuals and community members to be able to fight against TB in their communities?
Okay. Yeah, so there's a critical detail that I omitted when I spoke earlier. Today, Minister is expected to launch the End TB campaign. So we expect that people should really follow that because this campaign is really aiming at creating awareness, bringing knowledge among people of South Africa in terms of TB so that they could seek care in terms of screening. They should access TB screening, TB testing, and if found to have TB, then they get treatment. Now, such a campaign will also lead to reduction of stigma. So I really call upon the people of South Africa to support that NTB campaign that Minister is expected to launch today. And this campaign follows the 1.1 million Closing the Gap HIV campaign. So the two campaigns are really doing the same thing, finding people with HIV, those who are not on ART, but we know they're living with HIV, and also finding TB in the process, because in order to end TB and HIV, we got to find people who have these two conditions and put them on treatment. So that's really critical. The two campaigns need to be supported.
Thank you, Prof, for the wonderful information that you shared today with us. I think it for a certain individual at home, I think, just before we close, can you, like, for example, I'm taking the treatment. How would you inspire me to actually go back, since we know we have got issues of people who are not taking, they're starting treatment and they stop? How would you empower a person? There's a certain individual that's just sitting at home. That's what will be our final closing from the National Department of Health.
Thank you. So taking treatment has a lot of benefit. It keeps you healthy. And you can continue with the activities. You can continue working until you reach an age where you become pensionable. So it's really important to stay on treatment. There are a lot of benefits. We all want to live. Quantity of life is okay, but quality is, I think, is a plus that we need. And that's what to get from taking treatment.
Thank you very much for joining us today, Prof. Continue doing the beautiful work that you've been doing with the National Department. And we look forward to having more feedback from the department. Next time probably will be a different issue of saying, this is how many people we've reached and we're actually achieving that goal. Because from now until 2030, we still have a long way to go to be able to reach our targets for the Sustainable Development Goals and also the TB control. Thank you very much.
Thank you.
Prof has literally spoken to us about TB, and the key message that I found from this message is that don't stop taking your treatment no matter how bad it may look. You can still survive, you can reach your 60s, and you can still be able to be the person that you are. So without further ado, please make sure that you follow us on all social media platforms at SANEC_trust, and simply just go to our call to action number with 067-267-3103. And please join us same time, same place, sharp.